Hello. Are you someone who suffers from synkinesis post Bell's palsy? Do you feel that the affected side of your eye is becoming smaller than the non affected side? Then this video is definitely for you, where I will be explaining you why your eyes are getting smaller post synkinesis development, how to identify whether you've got synkinesis or not, and what you should do in order to control the synkinesis. Everything in this one video. So make sure to watch this video till the end. Let's begin. Friends, synkinesis is a complication of Bell's palsy. Unlike Bell's palsy, where there is damage to the nerve due to inflammation or infection, in synkinesis, the brain develops wrong patterns. These patterns develop due to multiple reasons. Now, let me explain what exactly happens in synkinesis. So, when you suffer from Bell's palsy, your one side of the face is paralyzed. Now, due to which, what will happen? The muscles on the affected side of the face, which you can see here, these muscles on the affected side of the face will be paralyzed, which means they will not be functioning. Now, what will happen when they will not be functioning? Due to the effect of the gravity, these muscles will start drooping downwards or falling downwards. This eventually leads to more pressure that the muscles have to exert to do a general movement as well. For example, let's say your cheeks are drooped due to Bell's palsy. The cheek muscles have to work harder than usual to speak, to smile, to chew as well. Now, since the muscles are already paralyzed and weak, at the same time they have this impact of gravity, whenever you try to do a facial movement in the form of an expression, or when you are trying to speak, or else when you are trying to swallow, there is an additional support or power that these muscles needs. But unfortunately, due to Bell's palsy, this power is not reaching to these muscles due to damage to the nerve. So, what these muscles will do? They will try to take help of whatever source of power that they can get. So, let's say you are recovering from Bell's palsy and there is some power that has come on the face, right? But it's not enough for the facial muscles to utilize to do your facial expression or do anything, right? That's where the facial muscles will collectively start helping the muscle that needs to work. So, for example, as you can see in this diagram, let's say when you are trying to smile, this is the muscle that are supposed to be working, correct? To lift your cheek muscles. These muscle needs to relax. But since this is weak, the muscles here will also start contracting and the muscles here will also start contracting. Muscles here will also start contracting and muscles here will also start contracting. But where will they contract? They will contract in the direction in which they function. So for example, whenever you are trying to smile, this muscle is trying to help this side of the muscle with the force, right? That's where these muscles will contract in its original direction, which is closing direction, correct? And that's where it is called as oro-ocular synkinesis, which means whenever you are trying to activate your cheek muscles, the eye muscles contract. Say that when you have read on Google about Bell's palsy or synkinesis, there is a term which is called as aberrant renervation or aberrant regeneration. Now, there are also studies specifically done by Crystal Touch Bell's Palsy Clinic where they have shown that there is no physical damage that has happened to the nerve. So, sprouting or connecting of the nerve fibers physically with other fibers is actually not possible until unless there was a physical damage in your case, which is only a condition where your Bell's palsy is due to a tumor or else in surgery. In rest of the cases, Bell's palsy are compression based, so there is very less chances for a nerve to sprout outside the layers of it and branch with separate thing. So majorly, the studies by Crystal Touch Bell's Palsy Clinic has proven that it's a neuroplastic change that the brain develops, or else there is a change in the pattern of facial use over a period of time when a person suffers from Bell's palsy. And that's where synkinesis happen. Synkinesis is nothing but learned wrong usage of facial muscles. Now, when that happens on a very repeated mode, at the same time, when the eye muscles are also weak and they are constantly getting contracted with the mouth movement, they start getting weaker further and they start getting tensed further, due to which the eye muscles here and here start getting tight, tensed, fibrosed and contracted. Now when the eye muscle starts getting tensed, fibrosed and contracted, that's where your eye muscle starts looking smaller, which is the biggest complaint of synkinesis patients. So now the question arises, what one should do in order to prevent and stop this eye closure or else eye shortening? Well, the solution to this problem lies in prevention. Early intervention is very critical when it comes to Bell's palsy management. First of all, please don't take Bell's palsy lightly. There are a lot of people who think that it will automatically regenerate or come back again. Please take your medications on time. If you take your medication in for 72 hours, your likelihood of recovery is much higher compared to the cases where you don't take medication. Second, don't force your facial muscles. Don't think that more you do contraction or more exercises you do, the more recovery will happen. In fact, if you force your facial muscles in the initial phase of Bell's palsy, you are inviting synkinesis more and more on your recovery timeline. Number 3, don't rely on external stimulation, because external stimulation is nothing but trying to switch on a light without a wire by just applying a current on the bulb. Ever a bulb will lit if you put current on the bulb surface? No, right? It's that circuit that needs to be well connected. That wire should be preserved. The source of the current that is coming, that should be correct. Similarly, if you are forcing the facial muscles to contract from here, you are activating wrong way, a wrong pattern, a wrong pathway. There are certain things that you can do in order to prevent the shortening of the eyes. And as I mentioned, it starts from the initial phase of your Bell's palsy itself. If you are someone who has developed acute Bell's palsy, make this practice regularly. Lift your eyebrows and close your eyes and hold it for 10 counts. Practice this 3 to 4 times every 2 hours. Similarly, give a lower eyelid lift like this passively. Hold it for 10 counts and come back. Practice this as well every 2 hours. The more stretch you give to your eyelids at the initial phase, the shortening will be less. Second, you also need to work on relaxing this eyelid muscle. That's where eye massages comes into the picture. Do a regular eye massage in a lifting direction, in upward and circular direction like this regularly, to make sure that there is enough blood circulation, there is enough lymphatic drainage, and your recovery of these muscles also happens nicely at that time. The third thing that you should keep in mind is taping of your eyes. Make sure to tape your eyes enough at night so that there is a continuous stretch that your eyelid gets when you are sleeping. The more faster your eyelid recovery is, the better the chances of synkinesis prevention is. Let's say if you do all of these things, but still your eye movement doesn't come back, what you do in the later stages? In the later stages, when your blinks have kind of improved, don't try to do this, which is forcefully shutting the eyes, because again you are forcing the facial muscle. At the same time, as I told you, your mouth movements are linked to your eye movements. So don't try to speak fast. Instead, try to speak softly and gently. Don't try to overcompensate your speech by using the non-affected side of the face. I see a lot of patients doing this mistake. They start using the non-affected side far more than the affected side. This creates a state of imbalance on the face, making it further complicated. So make sure that you keep the normal side of the face relaxed. Use small, softer and gentler words. Don't force your mouth muscles to speak much. Speak less, speak softly and speak gently. At the same time, avoid wide mouth movements. For example, opening your mouth wide or else yawning. Instead, you can close your mouth and then yawn. So these kind of precautions, if you take when you're recovering from the Bell's palsy, you can also reduce your likelihood of eye getting shorter. And then, let's say for the ones who have already developed eye shortness, what to be done? In your case, you need to work a lot on relaxing your mouth muscles. Yes, you heard me right. You need to first relax your mouth muscles. You need to make sure that there is no pain, no tension, no spasms in the mouth region. Apply deep pressure. Do good deep massages on the cheeks, in order to ensure that there is less strain falling on the eyes. Similarly, do regular eye massages and stretches, which is depending on your case. See, synkinesis, even though eye looks smaller, for few patients the contracture comes here, for few patients contracture come here. So we need to identify where the contracture is, and based on that only the massages and the direction is determined. So take professional help if you have already developed synkinesis, or else your eyes are looking shorter. This will ensure that you have a right path of recovery. Synkinesis is a tricky problem to solve, and I tell this to everyone. It's not that straightforward that you learn one set of exercises and that's it. You will be able to do it forever. It needs to be done in a straight and structured pattern, and that's where we can help you. We have some unique programs and activities that we have planned out with which we can help synkinesis patients. If you are someone who is suffering from synkinesis and want to know more about synkinesis, you can join our workshop and webinar that we organize every month. The link to register there is mentioned in the description, or else if you want to take a one-on-one consultation, you can book that as well. You can reach out to our website and book an appointment, and then you can learn how the synkinesis can be managed further. I hope this video was informative and helpful for you. On that note, I'll end this video here, and I'll see you in another video. Thank you.